My name is Nancy Guerra. I'm 60 years old. I have multiple myeloma and I was diagnosed in 2007.
Multiple myeloma is a cancer that comes from a cell growing abnormally in our bone marrow. It can do these multiple things.
Specific cells called plasma cells start to grow at a rate that is abnormal.
The antibodies that your white blood cells produce are defective, and so you end up without an immune system and makes you very susceptible to infections.
The protein they make can damage our heart, lungs, liver, kidneys, and untreated, this is a very life-threatening cancer.
The diagnosis then becomes clearer when you put all of those things together.
Bone marrow transplant has been shown in multiple studies to provide deeper, longer lasting remissions for these patients compared to not getting bone marrow transplants.
A disease which used to have an anticipated survival, somewhere in the 2.5 to maybe 3-year range. We can have people who live many, many years, sometimes up to a decade or more, even with the diagnosis of myeloma. We often have patients who can do very well with their initial transplants and as a result have a long period of what we call disease-free survival, where they're really not on a whole lot of medication or therapy.
Congratulations, Nancy. Having a transplant center here in Austin is making a huge difference in my life. I don't have to travel. I can be at home. I can have friends to help me out and to visit with me. It's something I wouldn't have if I was in San Antonio. Being in Austin makes all the difference.
With our new bone marrow transplant program, St. David's Healthcare is filling a critical gap in Austin's healthcare infrastructure in collaboration with the Texas Transplant Institute, the Sarah Cannon Blood Cancer Network, and Texas Oncology. St. David's is pleased to offer this specialized cancer care, and we hope that by bringing it to Austin, we can make a difficult journey a little easier for patients who can now get the highest quality care closer to home.
To have St. David's invest in the resources, the infrastructure, the ward, to hire the nurses, the specialized oncology nurses who now are trained in bone marrow transplant is a huge undertaking. To bring in the technicians and support staff, the pharmacists, the social worker, the chaplain, it's all very important for a bone marrow transplant team to have that in place.
Being able to have a transplant at St. David's is making all the difference to my life. Going back and forth to San Antonio was really pretty much an ordeal for me.
She was not even sure that she would be able to consider it unless it were available here in Austin. So we truly have impacted her life significantly by having bone marrow transplant services here in Austin. And I think both she and I couldn't be more grateful for that opportunity.
Since I've been discharged from the hospital, I've been getting stronger and stronger every day. I definitely am looking forward to that 100-day checkup. I have a number of tests that I have to take before that, and at that point we'll know that all of the cancer is gone.
To hear a patient say that their bone marrow transplant saved their life means the world to me, because that's why we're here. We're here to give patients treatment that returns them back to living their life.
Having the transplant center here in Central Texas made an enormous help in my life, and I'm sure it will in the lives of other people who are also awaiting transplants.